Welcome to the Patients Professors Academy module on the evaluation of engagement. My name is Joey Mattingly. I am a pharmacist and health economist and associate professor and vice chair of academic affairs here at the University of Maryland School of Pharmacy. Throughout this module, we'll be referencing the Principles of Community Engagement, 2nd edition. This book is available and free online with the link below. In this module, we'll be focusing on Chapter 7, Program Evaluation and Evaluating Community Engagement. After completing this module, you'll be able to define 5 common evaluation types used in the evaluation of engagement. You'll also be able to select an appropriate evaluation method based on the type of engagement. Finally, you'll be able to adapt an evaluation template to fit a hypothetical engagement project. Let's begin by defining evaluation. So what do we mean by the term evaluation in the context of patient and community engagement? We'll use the definition common for program evaluation. Essentially, it's the systematic collection of information about activities, characteristics, and outcomes that may be used to reduce uncertainties, improve effectiveness, or make decisions based on the results of that program. Evaluation can be classified into 5 types by intended use: formative, process, summative, outcome, and impact. Formative evaluation provides information to guide program involvement, whereas process evaluation determines whether a program is delivered as intended to the target recipients. Formative and process evaluations are appropriate to conduct during the implementation of a program. Summative evaluation informs judgments about whether the program worked. For example, did the goals and objectives were they actually met? And it requires making explicit criteria and evidence being used to make summary judgments. Outcome evaluations focuses on the observable conditions of a specific population, or an organizational attribute, or social condition that a program is expected to have changed. Outcome evaluation tends to focus on conditions or behaviors that the program was expected to affect most directly and immediately, whereas impact evaluation examines the program's long-term goals. Summative, outcome, and impact evaluations are appropriate to conduct when the program has either been completed or has been ongoing for a substantial period of time. Let's consider a few examples. We assess the strategies used to implement a weight loss program for type 2 diabetics and measured the degree to which it reached the target population. With this statement, we're focusing on whether or not the program used actually got to the people that we intended it to go to. This is a process evaluation. In the next example, we examine how many participants in our weight loss program reached their desired weight loss goal. This is considered an outcome evaluation because it's focused on the outcomes of the patients or the participants in the program. Federal organizations like the Centers for Disease Control and Prevention have also created a framework for program evaluation. In the CDC framework, they recommend to engage stakeholders to ensure that all partners invested in what will be learned from the evaluation describe the program to clearly identify its goals and objectives. The evaluation design should be useful, feasible, ethical, and accurate. You'd want to gather credible evidence, justify the conclusions or link to the results from your evaluation, and then make sure that the use of the evaluation and the lessons learned are shared. There's also a joint committee on standards for educational evaluation that we can learn from. From this joint committee, they recommend that standards include propriety, utility, feasibility, and accuracy. So what does that mean? Proprietary standards focus on ensuring that an evaluation is going to be conducted legally, ethically, and with regard to promoting the welfare of those involved or affected by the program evaluation. In addition to the rights of human subjects that are a concern of institutional review boards, proprietary standards promote a service orientation, meaning designing the evaluations to address and serve the needs of the program's targeted participants. Additionally, fairness in identifying program strengths and weaknesses, formal agreements, avoidance of disclosure of conflict of interest, and fiscal responsibility. Utility standards are intended to ensure that the evaluation will meet the information needs of the intended users, involving stakeholders using credible evaluation methods, asking pertinent questions, including these stakeholder perspectives, and providing clear and timely evaluation reports help improve or give attention to the utility standards. Feasibility standards are intended to make sure that the evaluation scope and methods are realistic. The scope of the information collected should ensure that the data provided to stakeholders with sufficient information to make decisions regarding the program. Finally, accuracy standards. These are intended to ensure that the evaluation reports use valid methods. And these methods used for evaluations are transparent, and in the description of those methods, they're trying to meet accuracy standards. So this may include using different types of methods like quantitative or qualitative or mixed, selecting justifiable informants, and drawing conclusions that are consistent with the data. Phases of evaluation. When we think about evaluating programs of engagement, we want to consider 4 different phases: the planning phase, implementation phase, completion phase, and dissemination phase. In the planning phase, our evaluation should be focusing on determining the feasibility of the evaluation. Additionally, identifying who are our appropriate stakeholders, who are the people that we want to engage, who has a interested stake in what we're trying to understand. Additionally, we want to specify any short and long-term goals of the project. Evaluation during the implementation phase includes things like assessing the program recruitment and retention of participants. How well is the project maintaining the program's timelines? What about the coordinating of ongoing programs or activities? And finally, are we effectively using the resources? Following the completion of a project, that's where we start shifting to thinking about things like outcomes and outcome evaluation, impact evaluation, those types of evaluation. What are some of the immediate outcomes that we found from our program? Additionally, how might we evaluate the program's long-term impact, or maybe the potential to have a long-term impact? Finally, we want to summarize the program's efficiency and sustainability, again, back to how we used our resources. After the completion phase, we have the dissemination phase. This is where we're trying to share our results. So how do we evaluate our dissemination? We should determine how well our results were reported to the desired audiences. We should assess the appropriateness of the different dissemination channels. Finally, evaluating the content and the format of the reported results. What are some example evaluation questions? Well, it depends on the phase that we're in, right? So while we're in the planning phase, one type of question may be, how many people are impacted by the problem we're trying to solve? In this term, when we ask how many, that's like a quantitative evaluation method. And we'll talk a little bit more about methods of evaluation in the next section. In the planning phase, we may also ask questions that are more qualitative in nature, like what are the values of the different stakeholders involved? What are the expectations of the participants? At the implementation phase, that's where we may ask things like how many people are participating, or to what extent the intervention is culturally or contextually valid. In the outcomes phase, we want to ask questions that may relate to the impact on quality of life or the change in health or health outcomes. Potentially we may ask what are the personal stories of those who participated, what are the themes that reflect the participants' experience. So again, the types of questions we ask may really relate to what phase of the project we're in, and then the type of data we want to collect. Methods of evaluation. In this module, we're going to cover 3 broad categories of methods. We'll discuss quantitative methods, qualitative methods, and mixed methods, which essentially include both qualitative and quantitative methods in the same approach. Quantitative research methods or evaluation methods focus on information that can be counted. possible ways to collect quantitative data may include a questionnaire, or maybe pre- and post-test surveys, or direct observation. Quantitative data typically involves statistical analyses as well. Often you'll see these reported using descriptive statistics, where we describe the full sample, maybe the average education for the population, or the average income. The limitations for quantitative data may include things like poor response rates on the surveys, or difficulty validating the survey instrument. Additionally, with quantitative data, it often lacks an in-depth understanding of the context of the experiences of the respondents, because again, you're limited to what you ask in the questionnaire. Qualitative methods focus on information that is more in-depth. There are different ways to collect qualitative data. Frequently, we use interviews or focus groups, maybe case studies. Now, qualitative data typically involves identifying themes or categories of items that come from those interviews and focus groups. Now, the limitations of this type of approach is that it's often not as generalizable as quantitative data that maybe represents a larger sample. Also, qualitative data can be time-consuming to collect. And there's also a complexity in the data analysis and the categorization and thematic analysis components of trying to identify the themes in that rich data. Finally, we discuss mixed methods, and this essentially is combining both quantitative and qualitative approaches. I like to think of this as when we integrate these two methods, we have to consider whether we want to do a sequential integration, where maybe we use one method first and then the second method after we've completed the first method. So this might include conducting a series of interviews with patients to identify the different experiences that they have through a treatment. However, we want to then maybe follow up with a large survey to a much larger sample of patients that is informed by those initial interviews. This is an example of a sequential qualitative and quantitative approach. We can also do these in parallel, recognizing that the quantitative data and the qualitative data will not, they'll be independent of each other, so one's not reliant on the other, and so we may get different answers, but they can still be informative to our research because we're collecting data in two different ways. One of the biggest limitations to using mixed methods is that you need expertise in both methods. Often researchers may be trained in one or the other, and maybe less often both. So it sometimes can be difficult for the research team to have all those experiences. So it's great. That's why we often see larger collaborations with multiple types of researchers on the team. And with that, needing the expertise, that may also include more cost and time as well. Thank you for listening to this module for the Patient Professors Academy. We look forward to seeing you soon in our live discussions. Thank you.